Good morning. My name is Regina Ikang. My presentation is on community health promotion. I am presenting my documentation on a video over PowerPoint. My healthcare community is the Veteran Affairs Administration. The United States Department of Veterans Affairs, VA, is a federal cabinet level agency that provides healthcare services to eligible military veterans at VA medical center and outpatient clinics located throughout the country. In the Washington metropolitan area, veterans receive care in both the main medical center and the community health clinics. My next subheading is healthcare access. My healthcare community is the Veterans Affairs Medical Center where I work. The VA Medical Center offers several services to veterans and employees. In order to reach more veterans and increase healthcare access, there are community clinics that serve the main medical centers, providing numerous medical services to veterans in the community. In the District of Columbia, Maryland, Virginia, altogether we refer to it as DMV, there are 5 clinics that serve the Washington Metropolitan, and they are Charlotte Hall, Fort Belvoir, Montgomery County, Southeast DC, and Southern Prince George's County. These communities are strategically located to enable the veterans easy access to healthcare. On a visit to one of the clinics, I specifically had a discussion with the community manager about the operation of the clinic. My visit took me to one of the inner city locations of the Southeastern Washington, DC clinic. Through our discussion, I gathered that 20 to 30 patients are attended to on a particular day, and services include primary care, mental health care, lab work, testing, teaching on diabetes, blood pressure, education on nutrition and wellness. My next subheading is local public health services. The VA collaborates with other public health service agencies to provide care for the veterans. It mobilizes community partnership to identify and solve health problems. The community-based clinic provides such services as screening for communicable diseases like tuberculosis and sexually transmitted disease, medical treatment including primary care and mental care, personal services like transportation and bus tickets to help veterans get to the clinic for care, diagnose and investigate health problems and health hazards in the community, monitor health status to identify community health problems. It also links people to needed personal health services and assure the provision of health care when otherwise unavailable. The effort also evaluates effectiveness, accessibility, and quality of personal and population-based health services. Like I said, veterans can also receive care from providers in the community with the cost paid by the VA. Community care is available based on the veteran's need and eligibility. Sometimes veterans need to obtain authorization to receive community care from other providers. Community public health care includes emergency care, flu shots, vaccination and immunization, and home care. Through my discussion, I realized that treatment for HIV and AIDS was not being offered at these Southeastern clinic location. We discussed the need for provision of these services at this location, and because it will help raise the awareness, reduce stigma, and prevent the disease. The community center offer flu shots for the veterans and vaccination for children entering school are obtained at the local health centers. According to the CDC National Immunization Survey, Maryland ranked 8th with 95.5%, and DC ranked second with 96.2%, while Virginia ranked the lowest, 88.6, at 54 out of 50 states plus the district. The local health center can provide free vaccination to the children without health insurance. They can also provide flu shots for the children free, and if they have to get it in the drugstore or urgent care, it costs less than $20. The VA has a well-prepared team for disaster planning, as up-to-date information is on the intranet. Employees are expected to complete competencies fully for the year. The information is provided by the Office of Public Health, and it provides a planned and reference tool that tells what to do before, during, and after a serious natural or man-made disaster. In case of actual emergency, every employee has an awareness of where to find the information in the manual and what to do to effectively cope with the disaster scenario. My next subheading is health education and promotion. The VA is always running programs for health education and promotion for the patients and employees. A recent community engagement is the campaign to get the patients and employees to breathe better air through the smoke-free VHA, which takes off on October 1, 2019. Posters are already placed on conspicuous places, as well as on the electronic billboard to communicate the message to the public. Health education focus can target general health, mental health, nutrition, and weight loss. The flu shot stroke education is one of the information provided by the VA for veterans, their families, volunteers, and employees. It raises awareness on the common symptoms of the flu and when to seek medical care. Another important issue of health education and promotion is the suicide prevention program. And September is the suicide prevention month. And so many activities are for the patients, employees, families, so as to bring awareness of suicide to the public. Everyone is educated on the warning signs of suicide and what to do to save veterans or anyone's life. The success of any of these programs, like the free VA, smoke-free VA, is yet to be determined. And it's with a feedback mechanism built into the campaign, we continue to make sure that the veterans are on the track to become smoke-free. And this will be determined as behavior will continue to be monitored to determine the success of the program. Other community engagement include the wellness calendar for the employee. For this month, the wellness calendar has a list of a variety of health promotion and wellness services for all the employees. The sessions include physical, spiritual, whole health, and other services as massages, yoga, meditation, some acupuncture for healthier workforce. And VA will continue to mobilize community partners to identify and solve health problems and continue to develop policies and plans that supports community health efforts. And thank you for listening to my presentation.